As of 2023, an estimated 6.7 million Americans over the age of 65 have Alzheimer's disease. And now a new study published in the journal Nature Medicine suggests that Alzheimer's disease may be inherited more often than previously known.
15% of Alzheimer's patients carry a specific gene, which has been identified for the first time to be an underlying cause of Alzheimer's disease. What does that mean and what can we do about it? In today's The Doctor Will See You Now, we invited Dr. Wang. He's a neurologist at Dignity Health Northridge Hospital to explain it all. Hi, doctor. Good to see you.
Hi. Thanks for inviting me.
So I asked you earlier, what are some of the main causes? And you said basically
that there is no specific identifiable cause or smoking gun that's been part of the disease process. We know there's two proteins involved in the disease, namely amyloid and tau. This abnormal formation of amyloid is what kickstarts the whole Alzheimer's disease process, and later on tau also comes in the picture and further drives the disease. But as far as the actual identifiable cause, there's nothing specific known outside of the genetic forms. We do know identifiable risk factors such as sedentary lifestyle, eating ultra-processed foods, things like that, even the microplastics that you may have heard about that have been shown as risk factors, but there is no, at this point, no smoking gun.
All right, so what exactly is the gene? It's called APOE4. What exactly is that?
Yeah, so the gene is actually APOE, and there are 3 mutations of this gene, E2, E3, and E4. E3 being the sort of what we call the normal mutation or normal, and E4 is being the bad mutation. Now, most people, everyone has 2 copies of the same gene, one from mom, one from dad. And so when you have 2 copies of the bad gene, you only have the bad gene, and that's what drives the disease. The gene itself is actually used in metabolizing cholesterol. And we actually have a lot of cholesterol in our brain, and that serves a normal function of our brain. So when you disrupt the normal metabolism of cholesterol, you damage the brain, and eventually that damage leads to the amyloid formation that drives the disease process in Alzheimer's.
You know, a lot of people go to the doctor once a year, they get tests done. Is this something that we can actually test for, and do we directly ask the doctor and say, I want to get this done?
So most of the commercially available testing kits for DNA actually do test for the APOE gene, and you can get tested either just by doing the commercially available kit, so you spit into a tube and you get back the results, or you can request the gene from your doctor's office. Either way, you can get results.
How do genes relate to Alzheimer's?
So the kickstarting process, the amyloid that I mentioned, there are genes associated with amyloid that actually basically drive formation of Alzheimer's. There are, for example, specific other genetic forms of Alzheimer's, people who get Alzheimer's in their 40s and 50s. Those genes are associated with Alzheimer's, but a small fraction, less than 1% of the overall Alzheimer's population. Down syndrome is another example. Everyone with Down syndrome, if you live long enough, actually will develop Alzheimer's disease, and that's simply because the amyloid gene lives in chromosome 21, and so when you have an extra copy of the amyloid gene, then you get excess amyloid, Alzheimer's disease.
Okay.
Is there an average age? Is it typically like over 65? You mentioned 40?
Yes.
Yeah, so there's actually 2 parts to this answer. One is the symptoms. The symptoms actually develop for most people with Alzheimer's disease in their 70s into their 80s. The genetic form that they identified in this study, you develop about a decade earlier in your 60s. You start developing symptoms, the memory loss, the confusion, the word finding difficulties. The second part to this answer is, although you have symptoms, you actually have the disease, the amyloid in your brain 10, 20 years prior. So even before any symptoms show up, you actually have the disease damaging your brain for about 10, 20 years before any evidence clinically that you can see.
Are there any treatment options? I mean, you talked about diet, but that is to slow it. What about if somebody actually has it? Is there any treatment options?
Definitely, and that's the most exciting part about all of this, is that before 2021, we had 2 classes of medications that were used to just sort of alter the neurochemical profile in our brain. And that was just a small sort of catch up in treating the symptoms, but not actually treating the disease. Since 2021, we now have 2 FDA-approved medications to actually remove amyloid from the brain, and then thereby actually going at the heart of the disease itself and treating the disease. And there are, in fact, now over 170 medications being actively tested to further see if we can treat the disease itself.
Wow, that's great news for that, at least, right? Thank you so much. Really appreciate you being here.
Thanks for having me.
All right.
All right, Dr. Wang's profile on the Dignity Health Northridge Hospital's website. Check that out to get more information. And if you know, if you got Alzheimer's or somebody in your family, this is the man to see.
All right. Thank you so much. Appreciate it.